Hello, welcome to Nursing Survival. I'm Nurse Camille, and today we're going to be talking about coronary artery disease. Please visit nursingsurvival.com for the study guide that goes along with this episode. I cover all the important areas of each topic. The total package has fill-in-the-blank and coloring page study guides. They'll help you stay engaged while you listen so you can retain the information even better. Coronary artery disease is also known as atherosclerosis. It occurs when plaque or cholesterol builds up in the major vessels of the heart, hence the name coronary artery disease. This causes the vessels to narrow and in turn decreases blood and oxygen supply to the heart and body. It is the most common heart disease and can be progressive, especially if not treated. Coronary artery disease, or CAD, can be caused by many different factors. Think of unhealthy habits such as smoking tobacco, poor diet, obesity, sedentary lifestyle. They can lead to plaque buildup in the heart. Hypertension can also lead to CAD. It puts extra pressure on the arteries in order to pump blood. This can alter the normal function of the heart, making it more susceptible to narrowing of the arteries. Hypertension is a blood pressure greater than 140/90. Diabetes is also linked to CAD. High blood glucose can lead to impaired cardiac function as well as permanent changes to the vessels. People with diabetes also normally have other comorbidities that can lead to CAD. Obesity, hypertension, and hyperlipidemia are often seen in patients with CAD. Men are usually more affected than women. A patient may have little to no signs or symptoms of CAD in the early stages. As CAD progresses, the vessels narrow and less blood and oxygen can flow through the heart. The lack of blood and oxygen can lead to shortness of breath as well as dyspnea on exertion. The patient may experience dizziness or weakness. The patient may report chest pressure or pain. Angina is chest pain often described as stabbing, and it may be triggered by stress. Diaphoresis is sweating. They may have tachycardia, which is a heart rate greater than 100 beats per minute. Heart palpitations, irregular heartbeat, and dysrhythmias are also symptoms. The patient may also have a heart attack. Sometimes a heart attack is the first sign of CAD. In order to diagnose CAD, a physician may review the patient's medical history as well as perform several diagnostic procedures. An electrocardiogram, or ECG, measures the electrical activity, rate, and rhythm of the heart. In patients with CAD, it may show an STT change. An ECG is non-invasive and does not take long to perform. An echocardiogram is an ultrasound of the heart. It helps to see how the heart is pumping blood and how the vessels are functioning. A stress test may be performed to evaluate how the heart is working. Stress is stimulated with either medication or exercise. The heart's response is monitored with an ECG. When the heart is under stress, it needs more blood and oxygen. Since patients with CAD have narrowing of the vessels, it cannot get the blood it needs. A chest X-ray may show heart enlargement and chest abnormalities. Cardiac catheterization is an invasive procedure that inserts a tiny catheter inside the vessels of the heart. It can allow visualization of the vessels and show blockages and narrowings. A coronary angiogram is part of a cardiac catheterization, but during the procedure, a contrast is injected into the vessels and X-rays are taken. It allows blockages and blood flow through the coronary arteries to be visualized. Coronary artery disease can cause a lot of complications. Since the coronary arteries are narrowed, the heart and the body receives less blood and oxygen. Angina is chest pain that results from lack of oxygen. Heart attack can occur when the vessels of the heart become blocked. Plaque can rupture or the vessels may narrow to the point where blood cannot reach the body. Heart failure can result from chronic lack of blood and oxygen. Arrhythmias are abnormal heartbeats. Blood and oxygen cannot reach the body when the heart is not beating correctly. Blood clots can form in the narrow vessels. If the plaque dislodges, it can travel in the arteries to the brain or the lungs. It can be life-threatening. Treatment of coronary artery disease includes lifestyle and medications. Treatment is dependent on the severity of the CAD. Lifestyle changes include diet, exercise, weight loss, stress reduction, and quitting smoking. There are several medications used to treat CAD. Anti-anginal medications are used to treat chest pain that can occur due to lack of oxygen to the heart. Nitroglycerin and isosorbide dinitrate are examples of anti-anginal medications. Nitro blocks calcium from entering the cells, which results in vasodilation. This allows adequate blood and oxygen to get to the heart and the body. Nitroglycerin is given sublingually. Side effects include dizziness, headache, and decreased blood pressure. Anticoagulants, such as aspirin and heparin, may be used to decrease the risk of blood clots and strokes. Blood can become stagnant in the blockages, forming a clot. Blood thinners help prevent this. Lipid-lowering medications such as bile acid, sequestrants, cholestyramine, and cholestyramine lower the cholesterol levels. Remember that CAD has cholesterol or plaque buildup in the arteries. Beta blockers reduce the heart's workload and vasodilate. This can help with angina as well as ensure that the body receives adequate blood and oxygen. Analgesics like acetaminophen can help with the headache associated with vasodilation. Morphine sulfate is another vasodilator that reduces the heart's workload, is a sedative, and relieves pain. A patient may need surgery if the blockage is too large for blood to flow. A coronary artery bypass graft, or CABG, is when a healthy artery from elsewhere in the body is grafted onto the coronary artery past the blockage. This creates a new path for the blood to flow. A coronary balloon angioplasty is a procedure in which the coronary artery is widened with a tiny balloon. Stenting is a procedure that pushes plaque out of the way and allows blood to flow past the blockage or narrowing. Nursing considerations for caring for a patient with coronary artery disease, including knowing the difference between stable and unstable angina. Stable angina is easily relieved with rest, has a short duration, and it usually occurs after stress, either mental or physical. Unstable angina has pain that lasts longer than 10 minutes and is not relieved with rest. The pain may be more intense. Unstable angina has changes to the typical chest pain that the patient experiences, such as the frequency, duration, and intensity. The pain may not be relieved with sublingual nitroglycerin. Nursing considerations for caring for a patient with chest pain include staying with the patient during the event, reducing stimulation, apply oxygen if needed, elevate the head of the bed if the patient is short of breath, monitor vital signs, and document the event. The physician may order an ECG. Other nursing considerations for CAD include monitoring the patient's vital signs, especially the blood pressure, with the administration of nitroglycerin. Remember that nitroglycerin causes vasodilation, which can lead to hypotension. The patient may experience a headache and need acetaminophen afterwards. Educate the patient on the importance of quitting smoking. Tobacco causes the blood vessels to constrict, which causes a further decrease in blood and oxygen. Encourage them to maintain a healthy lifestyle and diet. The DASH diet, decreasing fatty food intake, and reducing red meat consumption may be recommended. Exercise is important for a healthy life. They may need to incorporate it slowly and take plenty of breaks. Inform them that stress causes further reduction in blood and oxygen to the body. When the patient is experiencing chest pain, they need to rest, take their prescribed medication, and report any changes in the pain. If the pain lasts longer than 10 minutes or is unrelieved with medication, they need to get medical help. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. You can also find me on YouTube. Sign up for my email so you can be the first to know when new study guides come out. I also have special promotions and giveaways. Thank you.